Hello there, and welcome. My name is Calliope, and I'm going to be performing your comprehensive physical examination today. How are you doing today? Okay, I see. I hope by the time you leave this examination, you feel even just the littlest bit better. Now, if you wouldn't mind, just like to grab a few questions from you before we begin. Would you mind just confirming your name and date of birth? And is that the name you prefer to go by? And how do you like to be addressed? Excellent. Now, I'd like to just ask a couple of short questions to assess your orientation to time, place, and person. Would you mind just telling me what the current date is? I'm not one to keep track of dates very well either. Good, yep. And approximately what is the time? Or what time was your appointment? Good. And where are we currently located? We are at the hospital. And what state? Okay, very good. So to start off our examination today, I would like to just have a little feel around your head, your scalp, your face. So I'm going to be getting up pretty close, and for this examination, I am going to need to be touching you. Is that okay with you? Do I have your consent to do that? Wonderful. So I'm going to get up a little close. And I'm going to have a little feel around the head. There we go. And are there any particular places that you've had any lumps or bumps, any unusual pain? No? Okay. And do let me know if there's any pain or tenderness with any of this. Good. Over here. Have you noticed any itching or any burning sensations on the scalp at all? Okay. I'll just take a little peek through there. We'll just look for any little abnormalities in the skin, any signs of infestation, infection, lesions, ulcers, things of that sort. Okay. Now I'm going to pivot a bit, and I'm going to be palpating the lymph nodes from the clavicle up. We're going to start at the back of the head with the occipital notes. I'll work forward to postauricular, preauricular. We'll get into submental and submandibular, the different cervical nodes, and supraclavicular. Let me know if there's any pain or tenderness here. We have occipital right about at the hairline. And we can sweep up to postauricular. And our cervical nodes, our anterior cervical, posterior deep cervical chain, lots in the neck here. And then we have supraclavicular above the clavicle, superior, above. Good. Okay. Let's take a little peek at your face for a moment. So, any spots of concern with the face at all? Okay. Even if it's something you think is quite minor, do let me know. It might be something we can get fixed up in quite a jiff. Good, okay. And I'm just going to be pressing in on the different sinus cavities of the face. Then we're going to do a little direct percussion. Let me know if there's any pain or tenderness. So we're going to start by just pressing in to the frontal cavities. We have our frontal sinuses. We have ethmoid. And we have maxillary. Was that all okay? So I'm going to be tapping along these areas with my fingers. And let me know if anything feels off. Good. Then just tap, 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 tap. Okay. You'll give me just a moment. Good. Then let me take a little peek at the neck. When we were palpating the lymph nodes, but there's a lot more to the neck than that. Okay. Right. So this is about where your thyroid is at least where it should be. So if I could just have you take a dry swallow for me, just going to be feeling that area. Might be a little difficult. Don't worry about it if it's going to take you a couple moments. But if you could just take a dry swallow there. There we go. Good. So let's take a little listen. To the carotid artery. And we're going to listen for any audible heart murmurs. These are called bruits. I'm going to have you take a deep breath in and then hold it so that I can hear for any of those heart murmurs much easier. Take a deep breath in and hold. And I can just listen to the sound of the blood without the intrusion of the breathing. And release. Good. Take a deep breath in. And hold. Good. And release. Take this off for just a moment. And I'm going to be palpating the carotid as well. So I'm going to do it just one side at a time. And keep breathing normally here. I'm just going to assess the strength and quality. There we go. Good. And I am going to just assess a couple of the muscles of the face. So I'm going to start with the temporalis muscle. Do a little palpation here. And then if you could just open the jaw and close, open, close. Good. And now the masseter muscle. Okay, if you could open the jaw, close, open, close. Good. So let's take a little peek at the eyes. Again, I'm going to get up a little close here. And we're just going to look at the eyes. Look at the distribution of the eyelashes, of the eyebrows, and the color of the sclera, the iris, how the pupil reacts. And I'm just going to pull the eyelids up. I want you to look down. I'm going to pull up, you look down. Good. And then I'm going to pull down, and I want you to look up. Pull down, you look up. Good. Good. Okay. Blink a couple of times if you need to. Now, I think that everything looks good there. So I'd like to move to testing your visual acuity. For this, we're going to be using the Snellen chart. and a handy little pointer here. And we're going to take a look right at this board back here. If you could just tell me what this top letter is right here on the first line. Good. And what about this one here? Right here. F. P. Good. And what about this line, but backwards? Z or Z? O. T. And what about this line right here? Good. Good. Yep. And what about this line right here? Number 5. Yep. Good. 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 And number 6 here. If we could do this backwards. Good. C, F, D, E. And this line right here, number 7. F, E, L, O, P, Z, D. Good. This line right here. Let's do this backwards. Good. 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 Yep. Yep. Good. And right here, can you do this one right here? Good. Good. Yep. Yep. Good. Good. Let's try this one right down here. Let's go backwards. O, E, C, T, L, D, F. Very good. Very good. Now, I am going to be using a light to look at the eyes. So if I could just have you stare straight ahead. Good. Just keep looking straight ahead. Good. Just looking at how your pupils react to the light. Should be equal, round, and reactive to the light. Good. Good, okay. And would you mind just looking at the light here? And if you could just follow this using only your eyes without moving your head. If you can't quite see the light, I know it's a little weak, you're more than welcome to look at the head of this ophthalmoscope. Okay? Right, so let's go ahead and just go here. Good, just like that. Using only the eyes without moving the head. Moving through the cardinal directions of gaze. Just do the best you can. Good. let's go down, up, down, back up. Good. And let's go diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, and diagonally down. Good. And if you could just look at the light here, and I'm going to bring this in and out, in and out, in and out. I'll switch over here if you could just keep looking. In and out. In and out. In and out. There we go. Now lastly, I'm going to pop off my glasses for a moment so that we can perform a fundoscopy, which means I'm going to look at the fundus, or the back of the eye. I'm going to put my hand on top of your head so that I don't end up running into you. I'm going to come in at the side and look for what's known as a red light reflex. And then I'm just going to come in real slow. And we'll take a look at the little blood vessels, the optic disc, the macula. Good. Then come back and switch to the other side. Just going to look for that red light reflex. Come in real close. Be careful not to run into you. There we go. And then just looking around. There. That's a good view. Everything looks to be pretty darn healthy here. Okay, then I can back away a bit. And then flip this off. Good. Let me pop on my glasses again. And now I can see. I'd like to take a peek at your ears. For this, I'm also going to need a different tool. I'll just take this off. And instead, put on the otoscope. And a new speculum. There. That's all ready to go for us. So I'm going to have a look at the ears just as they are, and look at the interesting how everything has evolved to give us the best ability to hear the world around us. So I'm going to be just popping the otoscope into the ears, be pulling up and back so I can straighten out the canal, and we'll see what's going on in those ears of yours. I'm just going to pull up and back. Yeah, let's see if I can get this. Yeah, that's fine with the glasses. Okay. Now we have the external auditory meatus, however you want to say it. It's your ear canal. And then we have the tympanic membrane, or the eardrum. Then we have some structures like the stirrups, the anvil, and the hammer. Those are all right behind the tympanic membrane. Good. So we're looking for things like any impaction in the ear. We're looking for irritation, inflammation, signs of infection, looking for perforation of the tympanic membrane, looking for any sort of sign that something is not quite right. Good. Then we're going to do a little bit of work with the tuning fork here, and we are going to do the Weber and Rinne test. And these help tell us a little bit about if there is some sort of hearing loss going on, and if so, perhaps what kind. Have you had any issues with your hearing as of late? No. Okay. So I am going to be striking the tuning fork and putting it right on the forehead here. I want you to just tell me if you hear it on one side, the other, or right in the middle. One side, the other, right in the middle. Right in the middle. Okay. This time I'm going to strike the tuning fork and put it behind the ear, right on the mastoid process. And then I want you to tell me when you hear it and when it stops. When it stops, I'm going to put it in front of the ear. I want you to tell me when you hear it and when it stops. Hear that? When does it stop? Hear that? When does it stop? Good. Hear that? When does it stop? Hear that? When does it stop? Good. When does it stop? Stops. And it stops. Very good. Excellent. And I'm just going to be whispering a few words in each ear. I want you to just tell me what word you hear, right? Okay. Orange. Chartreuse. Turquoise. Yellow. Scarlet. Good. Purple. Black. Slate. Ecru. Beige. Okay, lots of color words. Very good. Now I'd like to take a little look at the nose, mouth, and throat. So I am going to just use the otoscope as a bit of light. So if you wouldn't mind just showing me the inside of your nose here. I know it's not a very fun thing, but I'm not going to go inside the nasal passages. I just want to have a look. Good. And then right in here. Very good. Okay. And now if you could put your head back down and open your mouth for me. Good. We'll just take a little peek here. Good. The teeth look good. Tissues there. The insides of the cheeks are buccal mucosa. Okay, would you mind just lifting your tongue up to the roof of your mouth? Good, and I'm just going to grab a tongue depressor here, and I could just have you say "ah" for me. Okay, uvula looks good, and then we're just going to look at the throat to see the throat wall, signs of cobblestoning, of the tonsils being irritated, any infection, that sort of thing, and that looks good. Okay. You can go ahead and close your mouth. Okay. And if I could have you do a little bit of range of movement for me. So if you could turn your head to one side. Good. The other. And up. Down. Tilt the head to one side. And the other. Good. And can you shrug the shoulders? Okay. And I'm going to try to press down on the shoulders. I want you to keep them shrugged up. We have some good strength there. And now if I could have you just do a few different facial movements for me. If you could raise your eyebrows. Okay, and close your eyes real tight. Puff out your cheeks. Smile real big. And frown. It's kind of hard to do on command. There you go. Very good. Okay. And then we'll bring out the stethoscope again. Now I am just going to have you take a deep breath in when I put the stethoscope on the chest, and a deep breath out. We'll just take a deep breath in and out. 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 Good. Now, when I put the stethoscope on your chest, I'm going to have you say the word 99. We're going to listen to the vocal resonance. I'm going to listen to how the word sounds in your lungs. You could just say the word 99. 99. 99. 99. 99. 99. Good. And we can also do a spot of percussion real quick. So I'm going to put my hand on your chest and tap on my fingers. I'm going to listen to the sounds that come back, whether they are quite dull or if they are hyper-resonant. Just going to have you stay still for me. Very good. Okay. Then let's go ahead and move to the heart. First, I'm going to do some palpation. We're going to feel for any palpable heart murmurs, heaves, and thrills. So I'm going to put my hand on your chest, and we'll feel with the heel of the hand and the flats of the fingers. Okay, and the fingers here. Turn the hand. Good, and I'm just going to locate the apex beat. This is at the mid-clavicular line. And the 5th intercostal space. Just going to feel that. Okay, and then we're going to bring the stethoscope back out. This time you don't need to breathe any way but normally. I'm going to start with listening to the aortic area. Right here. The pulmonary. Tricuspid. Mitral. And back to the apex beat. could have you lay back for a moment. Yeah, just recline back against the table there. And if I could just have you turn your head for me, I'm just going to look for any jugular venous distension here. We'll just look for a little bit. Okay, and you can bring your head back to neutral. And now I'm going to be listening to your abdomen. I'm going to start with the stethoscope, then we'll do some palpation. So if I could just have you breathe normally here. I'm just going to have a little listen around. Okay. And I'm going to do some palpation here. We're going to start with a firm palpation and then move to a deep palpation. So just keep breathing through this. For the firm palpation, I only need one hand. And do let me know if any of this is painful. Okay, and for the deep palpation, I'm going to use 2 hands, and this might be a little uncomfortable. Just keep breathing through it. It shouldn't last very long. I'm going to use deep palpation around the areas that just used our firm palpation for. Okay, and no problems. Let's bounce back to our notes real quick. And you can come sit back up. Now, if I could just see your hands for a moment, I'd like to inspect the hands, the nails, the joints, and we'll also feel the pulses. Let me take a peek at the hands. We're getting to that time of year where no matter how much you lotion, hands are just always kind of dry, huh? Yeah. Okay, good. And let me take a peek at the nails. We'll look at our capillary refill. Make sure we've got good circulation. That's looking really good. Good, and the hands are nice and warm. And any issues with the joints at all? No, everything's just fine. It's good. So as I'm palpating these, no pain? Okay. I'm going to have you put your fingers together and I'm going to squeeze the hand. I want you to tell me if that's painful. Okay, that's fine. And if you could splay the hands, and I'm going to try to push them together. You could just resist me. Okay. Good. Can you make a fist? And can you turn your hands up, down, in and out. Good. Okay. You can relax the hands, and I'm just going to feel our radial pulses here. Right underneath the thumb, along the radius bone. And I'm just going to feel both at the same time. Look for a radial delay. Okay, and those are pretty synchronized. So I am just going to have you do a couple of movement tests for me. Can you bring your arms all the way up? And how about all the way back? Right, and how about all the way up the side? Good. And can you put your arms up like this? I'm going to try to push you forward. I want you to resist me. Okay. Good. And I'm going to try to pull you towards me. I want you to resist me. Good. Okay. Let's take a peek at the legs and the feet. So, legs and the feet, we're looking for skin abnormalities primarily. Sometimes the shins can have some goofy happenings when there's something a bit wrong. Okay, and we can look at the feet. So the toes are warm, and I'm just going to check the capillary refill. Good. And any pain as I'm palpating here? No. Do you generally have any sort of foot pain? You're pretty alright. That's good. Nothing more than usual. And I'm going to check for any edema in the ankles, more specifically pitting edema. Don't want any of that mess. Okay. Good. And we're going to do a few different strength tests here. So I'm going to try to hold your thighs down. I want you to push them up against me. Good. And I am going to wrap my hands behind your lower legs. I want you to try to resist me pulling you towards me. Good. And I'm going to push on your shins. I want you to push back against me. Good. I'm going to push down on your toes, and I want you to push up against me. Good. And lastly, I'm going to try to pull your feet up, and I want you to push them down against me. Good. Would you mind just kicking out your foot a bit so that we can see the knee bend? Okay, all the way out. And let that one relax. All the way out. Let it relax. Good. Any pain or difficulty in any of this? Okay. Well, we've only got a few things left to do. So we're going to start with testing our reflexes. Now I'm going to employ the use of a buck hammer today, as well as our tailor hammer right here, or the tomahawk hammer. And I'm going to use this one for the blade here. This is how I'm going to elicit the Babinski reflex. So if I could just have your foot here, and I'm just going to stroke the blade on the outside of the foot, outer part of the sole. Okay, and the other one. Good. Now, in most people, the toes should curl downward, unless you're like me and trained yourself to make them go laterally instead. And for, I believe it's children under 3, they also will splay the toes. And then we can bring in the buck hammer. I'm going to be eliciting the Achilles reflex. So if I could just see your foot. And I'm going to support it a bit so then we can get right on the tendon there. The other side. You just let me have the foot, let it relax. Good. And I'm sure you know the knee jerk well. Okay, just let the leg relax. Okay. Very good. And we'll do the triceps and biceps reflex. So if I could have your arm here and just lay it out, let it relax. I'm going to get that little bit of the tendon right there. I'm going to put my thumb on top of it, and the rest of my fingers are going to curl around your elbow here. We're just going to do a little. Good. The other side. Fingers go around the elbow. Thumb goes on top of the tendon. Okay. And then the triceps right back here. If I could just hold your arm here, and I'm going to bring it up and just let it go floppy. Good. And the other side. Just pick up the arm here. There we go. That one's a little more difficult. Good. For our very last test, I'm going to need you to stand up for me. Good. I'm going to have you close your eyes. I'm going to try to sway you, and I want you to keep me from doing that, okay? Now, you're not going to fall even as I'm swaying you. If you happen to go too much one way, I will catch you here. But I'm going to try to sway you. I want you to just keep balanced. Good. And now I'd like to test your walking, your gait a little bit. So if you could walk to the end of the room, just regular. And if you could walk back on your toes, it's actually how I always walk. And if you could walk back on your heels. And if you could come back heel to toe so that your toes and your heels touch as you're walking. One foot right in front of the other. Also known as tandem walking. Very good. Go ahead and sit down, and that will conclude our examination. Do you have any particular questions for me at all? No? Okay. Let me go ahead and sign off. be it. I'd like to thank you so much for coming to the hospital to have your examination today. Really appreciate it. You're a model patient. I hope you have a whale of a day and a good rest of your night. Thank you.